Last week I spoke to you about an optic nerve pathology caused by one's artery system being inflamed throughout the body. It's called arteritic ischemic optic neuropathy or giant cell arteritis, and it is life-threatening. Today I'm going to talk to you about a different optic nerve pathology. This one is not life-threatening, but it can certainly affect your health and your vision. Hi, Dr. Mike Vernon. Nice to see you again. So literally last week, I had a young woman, 20 years old, slightly overweight, come to see me with some complaints. She explained to me that she had a history of migraines, but that over the past few months, she had been experiencing an increase in intensity and frequency of headaches. She also explained to me that she would lose her vision a few times a week that would last for seconds. Now that is a very specific and weird complaint. Anyway, I performed the eye exam, and to make a long story short, I didn't find anything the matter. Everything seemed to be normal, and I started to explain this to her. Except I had not looked at the back of her eyes. When I do a comprehensive eye exam, I take pictures of the back of everybody's eyes. And normally, I look at the pictures before I start the eye exams. However, in this case, I had not looked at the pictures yet. So as I was summing up, I told my patient, hey, one more thing, let me look at the pictures of the back of the eyes. And this is what I saw. These are her photos. Look at her optic nerves. For comparison's sake, this is what normal optic nerves look like. Do you notice that the edges of her optic nerves look slightly feathery and indistinct? Also, to my trained eye, I can tell that her optic nerves are protruding forward ever so slightly. Can you appreciate that? Both of her optic nerves are slightly swollen. Now, there are a number of conditions and diseases that can cause papilledema, or swollen optic nerve heads, and they need to be considered. But in this young woman's case, I was fairly certain that she had a condition called idiopathic intracranial hypertension, also known as pseudotumor cerebri. It is not a condition that I see very often. Maybe a handful of times I've seen it in my career, but here it was. Idiopathic intracranial hypertension, let's just call it IIH, is a syndrome caused by elevated intracranial pressure. More specifically, it's caused by elevated pressure of the cerebrospinal fluid. Cerebrospinal fluid bathes and cushions the entire central nervous system. You know, the brain, its nerves, the spinal cord. If that pressure of the cerebral spinal fluid becomes elevated, it can cause papilledema. It can also cause symptoms of increased intensity and frequency of headaches, and it can also cause one's vision to go out lasting seconds, like my patient. To make an official diagnosis of IIH, there are three things that need to happen. One is there must be swollen optic nerve heads, papilledema. The second thing is that there must be a scan of the head and neck done, an MRI, to confirm that there are no lesions or tumors. The third thing that needs to happen is that the cerebral spinal fluid needs to be measured, and it's measured via a lumbar puncture. A lumbar puncture is when a needle is inserted into one's lower back, and then the pressure reading is taken. And a lumbar puncture is not particularly comfortable. Okay, so we're going to consider that my patient has IIH. Do you remember when I told you earlier that she's slightly overweight? Being overweight is somewhat common with this condition, as is being female and young. So, the number one preferred way to manage this condition is to encourage weight loss. Also, oral contraceptives and some medicines can be a contributing factor in causing IIH, and ceasing those medicines should be considered. Finally, if IIH is moderate to severe or is not responding very well to weight loss alone, then there is a medicine that can be used. It's a diuretic called acetazolamide. A patient with IIH should be followed and seen every 1 to 3 months. It doesn't respond very quickly to therapy, but slowly and surely, with adherence to the therapies, IIH will get better and it'll eventually resolve.